Well, hello and welcome to another Thursday Live here at the Association of PEMF Professionals, where we are all about helping those of you with PEMF machines go forth and either perform PEMF on yourselves, on your family, on your livestock, animals, building business, and also providing certifications for those of you that want to explore more, where you learn all about large animals, small animals, and humans. Today, what we want to do is continue along with our Women's History Month series. And we've got some hashtags here too. So if you want to help share this, you can use any of these hashtags. That'll put this video that you're watching in that hashtag system. And we are going to be moving forward with today's talk, which is PEMF for new moms. And those of you that have been following along know that there are a whole bunch of amazing things that are out there that PEMF can help with. And I want to touch a little bit about what we've got in the realm of new moms, postpartum breastfeeding. Those of you that have seen other lectures that we've done and other companies that have done lectures on PEMF, that there's a lot of amazing things that are there and that you can provide to help young moms, but also multiple birth moms on helping them with their post-delivery things going on. But emerging research suggests PEMF may support postpartum recovery, mental well-being, and physical healing. So that's the broad scope of what we're talking about. PEMF and postpartum depression. It affects up to 15% of new mothers with symptoms including sadness, anxiety, fatigue. There's a lot of hormonal shifts going on, some sleep deprivation. Those are some key contributors going on to that as well. So as you know, PEMF is a pretty powerful machine when it comes to helping out with those symptoms. And the studies indicate that PEMF may reduce depression symptoms by enhancing cellular energy with improving brain function. There's some research out there as far as transcranial PEMF studies. They show mood improvement in treatment-resistant depression. So people that are trying other options, whether via medication or counseling, potentially applicable to postpartum cases, and also supports natural healing without medication, which is critical for breastfeeding moms. So that's the other issue, is how do you go about treating these things when, if there's any kind of medication that's being used, can cross the barrier and get into the infant. So that's the other nice thing about PEMF, is that it's all natural and that there's no harmful drugs that are being given to our little ones that are getting nutrients. The challenges on with the using the device, as far as, how long, how frequent, and again, there are a lot of professionals that are out there that are already doing this, and it's usually 10, 20 minutes. It's on the head and encompasses the brain. It's on a very, very low dose or power setting. If you have it on too high, you'll see an eyelid twitching, those kinds of things, or the jaw twitching. So you want to be well below that level. This is really where our low and slow come into play. And usually I would maybe put together a two-week program of daily and do 3 sets of 20 minutes. That would be the best system. And again, lots of fluids, making sure you're getting lots of water or liquids coming in. So that's how I would address it. And then we get into breastfeeding, and as far as breastfeeding challenges. And, those of you that have had problems or know of women that have had problems with breastfeeding, where the breast milk's coming in and you can get an infection. There's the tea bag going in there. But those of you that are treating animals know that PEMF is really good, especially for cows. If they're having any udder issues, any infections, that it releases that, relieves it. And we even have a couple of people that have attested to their own breast infections using PEMF, and how that has reduced inflammation, improved flow, stopped the blocking of what's going on. So even low milk supply, so the fatigue and the stress that goes on, PEMF has been a wonderful device for that. So if you know of any new moms that are having problems with this, I mean, it might even be something that you put on your card or your flyer that you're part of. And again, building your business, why not go to the birth and family clinics that are out there and talk about this device and how it helps with that? Because, if you've never been around an anxious mom whose milk isn't coming in, and all of the stress and the lack of sleep and the baby, and, whether to bottle feed or breastfeed and latching, all of these things, there's a bunch going on. And if you can help with the mental and with the flow of the milk, then you're going to be that hero to that mom. Now, the benefits with PEMF is that it's going to boost circulation and cellular metabolism, potentially supporting milk production indirectly through improved maternal health. There's no evidence of interference with breastfeeding, and unlike some medications, which again make it a safe option. And the anecdotal reports suggest reduced stress and better energy levels in moms using PEMF. And again, that's all part of it too, is the fatigue factor, especially if you got twins. I've got a niece that's got twins, and another friend that went through twins, and then triplets. So, you've got that whole story going on with multiple babies. And so, of course, you're going to want to make sure that everything's working properly, especially the reduction of stress. So I think that's probably one of the best things that PEMF can help out with. And then there's PEMF and postpartum infections. So the common postpartum infections with mastitis, uterine infections, and also incision site, if there's been a C-section, or if there's been any ripping or tearing, that can happen too. So PEMF is really good for the healing of that injury, which also decreases the amount of stress going on in the body and the bodily stress. So you've got, again, you can hit it out of the ballpark with being part of the birthing team, I guess, or even, working with home births and things like that being available. So as far as PEMF role goes, PEMF is known to reduce inflammation and promote tissue healing, which could help with infection recovery. And again, if you can do that, then there's no antibiotics. And again, there's no, transferring of medications over to the baby through the milk. Studies show PEMF accelerates wound healing and reduces swelling, again, post-surgical, which is relevant for C-section recovery. Potential antimicrobial effects suggest in some research, though more studies are needed. So, getting the white blood cells up and running around, getting the red blood cells, the basophils, all of those cells that go in and help with inflammation, infection, bacteria, a whole bunch of good stuff going on. In 2023, there was a review that noted PEMF's ability to enhance tissue repair and reduce inflammation, relevant for postpartum recovery. There was an 8-week study that was done on transcranial PEMF for treatment-resistant depression, which showed significant mood improvement. And postpartum specific data is limited, but the general benefits as far as reduced pain, better sleep, they align with the postpartum needs. And there is FDA approved for certain uses as far as like bone healing. We know bladder incontinence, which is considered safe with no known adverse effects on breastfeeding. So what more do you need to be able to use this? Again, the whole point of using PEMF is that there's no harsh chemicals, there's no side effects, it's all natural. So, you guys are definitely in the right field. As far as next steps and considerations, I think that there should be more targeted research on PEMF, specifically for postpartum depression and breastfeeding outcome. Even if you're out in the field and you're getting this information, giving it to us will help us out too, because we can be the source of that information. So if you've got some case studies, even though it's not a double-blind placebo, but if you're out in the field and you're getting these results, using us as the hub to collect all that information would be great. And then also going out and consulting healthcare providers before the use, especially with implanted devices. Again, some women may have pacemakers. Use your protocol when you are out there using PEMF on women. If they've got any kind of, I don't know what else would be in there, a TENS unit device, somewhere on their body, but, just go through your check system and make sure that you're not causing any problems with any mechanical or electronic devices. And the overall takeaway is that PEMF shows promise as safe, supportive therapy for new moms and potentially revolutionizing the postpartum care. So, again, if you're looking for an income stream, hook up with a doula. Home pregnancies, birth and family clinics. The nurses that are in the area. Even the breastfeeding clinics that are there, new mom clinics, if you can be a part of their team, you're going to have a very happy client. So with that, if you have a story, share it with us. Let us know what you've had. You can drop it in the comments here. Again, you can always reach out to us. But that is pretty much the short end of our talk today on PEMF for new moms. We've talked about all of the things that could be going on, how PEMF can help out with the postpartum depression, any kind of surgical, as far as helping that heal faster, and breastfeeding issues, and how that helps with any infections. And again, everybody knows a mom, right? or has a niece, a nephew, daughter, mom that's having a little one that this can help with. And you're welcome, Melissa. And again, this goes over into the animal world too. In fact, I think it came from the animal world as far as with the breast infections, as far as with dairy and how that's helped out. So those of you that have animal businesses, if you can go out there and promote yourself as somebody that helps with infections for better milk production, that's a good one too. And again, if you have any questions, reach out to us. You can know, like, and share, I guess is what I was trying to say, but you already know about us. So just like us and share us. And again, we've got some hashtags that you can use to promote our Women's History Month that we're turning into Women's Health Month for the month of March. But any of these hashtags will definitely help us spread the word. So again, I want to thank you again for your time on our talk today. And those of you that are members, we can talk more about this in the members only. Just drop a hello in there. And I see some more people requesting to be members. Those of you that are AOPP members can come in, and we just need to drop in there and approve that. Those of you that are watching this for the first time, don't know who we are or what we're about, on our website, you can see our code of ethics, who we are, what we're about, and I would say eat, sleep, and drink PEMF and how it can help uh, everything on the planet. I guess that's about as global as you can get. Speaking of global, we are in 17 countries. We have a great group of members, and we are going to continue with adding more content for those of you that are members. Outside of these Thursday lives, we'll be getting more courses up and running. So that's our awesome 2025, and of course our PEMF con that we've got up and going and brewing. So we'll have more information on that as well. So with that, I want to thank you very much. If you're interested in becoming a member, you always can jump on our website, PEMFprofessionals.com, and look under our membership information there. Questions, tips, hit us up, info@PEMFprofessionals.com. And I want to just say thanks today for those of you that are jumping on and that have liked our live and have dropped in and said hi. So I will again leave you to the rest of your Thursday and look forward to meeting you and talking with you again next week. So with that, I am going to end our little talk today with thanks, and see you next week.